Welcome everybody. This is the RCGP BMJ UK Health Alliance webinar on general practice reaching net zero carbon emissions by 2040. I'm Richard Smith and I'm the chair of the UK Health Alliance on climate change. We have about 20 members, which includes the RCGP, includes most of the Royal Colleges, the physicians, the surgeons, including the surgeons and physicians from Scotland, the psychiatrists, the nurses, and also the BMA, the Lancet, and the BMJ. And altogether, we have our members have 650,000 members, which obviously is a sizable chunk of the NHS workforce. I must apologise that Fiona Godley hasn't been able to make it. Unfortunately, she's not well, but I can assure you she's recovering. So, as I hope you're all aware, in order to avoid severe damage to health and the climate, the whole world has to reach net zero by 2040. And reaching net zero means that the carbon that we continue to produce, and there will always be some because carbon is everywhere, as if you don't know it already, you'll discover during this webinar. So the carbon we will still be producing will be absorbed by nature, by trees and forests, but also perhaps by technology, although lots of questions about the technology. And the great news is that if achieving that will be good for health of all of us, as well as good for the planet. And in order to reach net zero, absolutely everything has to change, including general practice. As you're perhaps aware, health and social care in Britain accounts for about 5% of the UK carbon emissions. In the US, it's 12%. And I hope you're also aware, NHS England has a plan for making this happen, which I hope you might have looked at. So this webinar will be discussing how can general practice play its part. Now, the whole thing is being recorded and will be available on the college website afterwards, and I hope you'll encourage anybody that couldn't make it to go and look at it. Questions will be included, but they will be anonymous. Now, the way you ask questions during the webinar is to use the Q&A function, but you can also make comments and share thoughts in the chat function. And we have a hashtag, which is #NetZeroGP. So I hope you might tweet it as well. I'll repeat that, #NetZeroGP. We're going to start with a poll in just a moment. We then have 3 presentations of 10 minutes each. Then we'll have another poll. Then we should have at least 15 minutes for discussion, and joining the panel will be Martin Marshall, the chair of the council. And we'll definitely be finished by 2 o'clock, so you can return to your practice. So let's start the poll. Let's have the first. Do you think acting on the climate crisis is part of your clinical role? You can see it there. Do you think acting on the climate crisis is part of your clinical role? So you can see, well, I'm not sure whether you can see it, but I can see it popping up here. Most people are agreeing that it is, but at least 15% are saying not part of a clinical role. So I can also see that there are 100 and, well, the numbers of you is going up. So we've almost everybody, we've got an 86% poll now. Okay, I think that's probably enough, is it? So there, I think you can see the result. So 77% have said yes, 8% are unsure, and 15% say it's not a clinical function. So it's something we might return to at the end, why people think that. So the next question is, do you know where general practice's carbon hotspots are? Do you know where general practice's carbon hotspots are? Well, if you don't know now, I think you will know by the end of this webinar, so you'll know where to concentrate your actions. So it's good that people are, so this is sort of roughly divided. So about nearly 40% are saying yes, a quarter are saying no, and about a third are not sure. So there's going to be lots of room to benefit from this webinar. Okay, there you can see the answers: 42% yes, 24% no, and a third are not sure. So you've everything to gain from this webinar. And the last question before we move into the presentations: have you used the Green Impact for Health tool? Have you used the Green Impact for Health tool? Well, presumably some of you haven't, or you would know where the hotspots were. So most people haven't so far. Yeah, so about 40% have, and about roughly 40% yes, 60% no, and a few unsure. Okay, well, there we are. So there's a sort of basis for the webinar. So let's move into the first presentation, which comes from Terry Kemple, who's a GP and RCGP national representative for sustainability, climate change, and green issues. This is a pre-recorded floating head, sounds rather ominous, minute video, and here we go.
Talk about what is net zero carbon general practice. It's when the greenhouse gas emissions from general practice are balanced by removing an equal amount of greenhouse gases from the atmosphere. The greenhouse gases, carbon dioxide, methane, nitrous oxide, and the halocarbons have different potencies. You can see in the diagram on the right that at the bottom, the little dot is carbon dioxide. And as you go up, the clouds get bigger and bigger. This is important because the inhalers that we use, the meter-dose inhalers that we use halofluorocarbons as the propellants, and these are 1,000 to 3,000 times more potent greenhouse gases than carbon dioxide. The choice now is whether we take the path to net zero or the path to climate change. If we allow climate change, then there are huge impacts on human health. If we choose to take the path to net zero, then in addition to preserving a livable climate, we can hope for many co-benefits for everybody living on the planet. So there is now a race to net zero. If we allow the climate to go above 1.5 degrees warmer, then we risk many other problems, including possible tipping points where changes are irreversible. To reach net zero and the 1.5 degree target won't be easy. We need a 7.6% annual reduction every year, and the pandemic only caused an 8% reduction in our greenhouse gas emissions. The UK can achieve net zero. We know what needs to be done. The UK's got a history with greenhouse gas emissions. We started early and we were the main polluter. Now, of course, there are other countries which have overtaken us. But because these greenhouse gases stay in the atmosphere for hundreds of years, our legacy is still around about 5% of the total greenhouse gas emissions in the atmosphere. Where's the UK now in the race to net zero? Well, you can see that it's coming down. The brown line includes everything that we use in the UK that is maybe manufactured offshore, because clearly we're not a manufacturing nation anymore, and we've, in a sense, offshored all our carbon emissions to other countries. But they're our carbon emissions. We own that footprint. Still a long way to go to net zero. So how have we got here so far? Well, the greatest reductions have been through changes in our power generation, moving from fossil fuels to the renewables. Most of these haven't meant that any of us have really had to make huge changes to our lifestyle. The NHS itself accounts for about 4.6% of all UK greenhouse gas emissions, and about 1 in 20 vehicle journeys is attributed to the NHS. The NHS has been carbon footprinted. You can see in the pie chart on the left that about 65% of our carbon footprint is from medicines, medical equipment, and other supply chain products. And if we break it down by sector in the diagram on the right, you can see that in primary care, that's arrow number 1, a large part of our carbon footprint is from those medicines, medical equipment, and other supply chain products, that's arrow number 2. But still quite a large part is also from arrow number 3, which is our use of metered dose inhalers. Arrow number 4, which you can't see because it's hidden behind my head, is staff and patient travel. That's all pre-pandemic, so this will have changed. So at the moment, we're all relatively carbon illiterate, but carbon literacy and understanding carbon footprints is going to be very important in the future. Because if we can't measure our carbon footprint, we certainly won't be able to manage a net zero world. So if you're not sure where to start in trying to understand carbon literacy, look at the UK Health Alliance for Climate Change webpage. There's frequently asked questions on carbon literacy and a quiz you can take. The NHS has quietly been reducing its carbon footprints since the 1990s. The direct part of its footprint has gone down 60%, and the supply chain has gone down by about 26%. But it still needs to do more, which is why the NHS is committed, the NHS in England is committed to become a net zero service by 2040 and by 2045 for its supply chain. And that supply chain accounts for 65% of the NHS carbon footprint. And if we look at that supply chain, we can see it's mostly due to manufacturing and processing and packaging and sterilisation. In general practice, 65 to 90% of our carbon footprint is related to medical treatments. But if we exclude those medical treatments, the remainder is in the pie chart. And again, most of it's down to patient and staff travel. Again, that's pre-pandemic, so that will have changed, but we need to be careful as we get back to normal after the pandemic to make sure that we avoid any unnecessary patient and staff travel. We want to optimise care, but we don't want to travel. If we look at inhalers, the metered dose inhalers that we use, we can see why they're different. Because the manufacture is only a small part of their carbon footprint. All their carbon footprint is from the use and disposal because of the propellants going into the atmosphere. And even in their disposal, if they're put into domestic waste, 25 to 50% of their carbon footprint is from the leakage of the propellants into the atmosphere. So metered dose inhalers should never be put in domestic waste. They should be returned to the pharmacy, where they can either be recycled or incinerated to destroy the hydrofluorocarbons. So the NHS knows what to do in its pathway to net zero. This is in bigger detail, and we will all be becoming much more aware of this in the future. In the past, one of the reasons we haven't done much is because we didn't really know what to do. It's been too complicated. And so we will be getting clearer and clearer about what we need to do to achieve net zero. But we can't do it alone. Clearly, the whole world has to take part of this, and that's why later this year in Glasgow, the UN, COP26, that's the Conference of the Parties, are having a conference, and the expectation there is that each of the countries will have to increase its commitment to reduce its greenhouse gas emissions so that we can achieve net zero by the deadlines. In summary, net zero is coming, and we don't want the very few doing every impossible thing. We need the many of us doing everything possible.
Good. Well, thank you very much, Terry. So now we're going to hear from Georgie Sowman, a GP and physical activity champion in the northeast of England at Public Health England. And she's going to be talking about what will net zero general practice look like.
Thanks so much. Hello, I'm Georgie. I'm a GP in the northeast, and my talk is net zero general practice. What would it look like? Thanks, Terry, for outlining the crucial need for us to act as healthcare professionals. If we were to reimagine general practice now, knowing about this critical relationship between human systems and the natural systems on which we depend, what would general practice look like? And I'll open up this challenging conversation today by welcoming ideas, visions, and actions in the chat, because we'll need as many different voices as possible to work towards a greener future for all. But to start, everyone would need to be aware of the health impacts of the climate and ecological emergency. And for net zero general practice, we would all understand the considerable benefits of action to health. And we'd also understand our hotspots, biggest impacts and opportunities, and we'd know what to do. Because net zero general practice is unique. It is key to delivering whole system net zero. By supporting our patients to thrive within their communities, we improve well-being and reduce admissions. Widespread health interventions, well supported by public health policies, have significant health benefits to people and the planet. And we can focus on inequalities. We know that those who have least equal access to health are also those most impacted by the climate emergency. And we have huge reach and value, and that reach is significant. We often think that the term anchor institution refers to larger organisations, but net zero general practice is embedded within communities. And when joined together, we are an anchor institution that really can act locally whilst thinking globally. And net zero general practice is also unique because its carbon footprint relates predominantly to clinical care. And this provides us with challenges as well as opportunities. So net zero general practice has a whole systems approach, a clear understanding of the benefits of making sure that we strengthen prevention, that we listen compassionately to what matters most to our patients, and we have evidence-based low carbon interventions easily accessible to us, and then clear, joined up and efficient systems to make this all work. And this means that net zero general practice will amplify and strengthen existing movements. And so we're able to deliver person-centered, population-based healthcare, care that benefits patients and planet with a view to leaving no one behind. So how do we understand better these wider benefits of general practice to health and the climate and ecological emergency? We're now going to go straight into the heart of general practice and into a hypothetical consultation with our patient, Sally. So Sally has type 2 diabetes and raised blood pressure. She works full-time in a sitting office job. She has to drive to school and then work, and there are huge barriers to her fitting movement into everyday life. But her HbA1c is creeping up. And it's really important to stress here that high quality management of long-term conditions with medications has a far lower carbon footprint and significantly less burden on our patients' physical, mental and social health than does poor control, with the complications and admissions that affords. But Sally doesn't want to increase her medicines. She's had loads of side effects and it's taken ages to get stable. And she keeps forgetting to take them because she's so busy. So finding she's inactive, she gives us permission to share information about the benefits of physical activity, along of course with a change in food, in stabilising her HbA1c. And in our net zero general practice, we have this information to hand in the same way and ease that we do with medications, and we're able to explore those other benefits too to becoming active. 66% lower risk of bone fractures, 40% lower risk of cognitive decline, 19% of colorectal cancer and 48% of depression. So she decides she'd be able to get up 2 to 3 times weekly and 20 minutes earlier, park away from the school and do that part of foot. Because she's doing this with her children, these benefits. And our net zero general practice has good knowledge of the added health benefits of physical activity in natural spaces to health. So we have a clear system to refer to our practice link worker, who has information and directories about local cycle, walking routes and green spaces. And we understand that access to nature is not equal, and we may have advocated with our patients for improved parks, cycle routes and opportunities locally. And we also understand the reciprocated benefits of re-engaging our patients with nature. We may also then share with Sally other benefits, because by spending less time in her car in traffic, she and her children are exposed to less air pollution. In fact, levels inside her car will be much higher than those when cycling and walking, especially in green spaces. Air pollution exposure contributes to over 36,000 deaths in the UK every single year. And it also increases the risks of long-term conditions, heart disease, strokes, asthma, and COPD. Now, our conversation with Sally may end here with good follow-up organised, but today we're going to explore wider benefits from this single intervention on a population level. Because these benefits and reduced rates of long-term conditions are also afforded to the cars in front and behind them, to the ecosystems and the roadsides, but also the local community. And we know that those with least equal access to health are those least likely to own their own vehicles, but are most likely to be affected most by climate change and air pollution. So reducing air pollution at a population level reduces the incidence and exacerbation of asthma and COPD, and potentially therefore inhalers. And Terry has mentioned the carbon hotspot of MDI inhalers in his talk. And these interactions, with their impact on climate change, air pollution, ocean acidification, to name a few, link us again with our natural systems. Finding our own carbon hotspots and understanding carbon literacy as GPs may be difficult or confusing, but in net zero general practice, we will have had support to identify our own footprints and our own hotspots in our non-clinical work too. And net zero general practice has got the tools and the resources, community and time to support this, whether as individuals, practices or more. And for the biggest impacts, this will also have meant organisational green plans potentially. So in doing so, net zero general practice will have reduced our energy use, decarbonised our energy use and helped to reduce fuel poverty in our patients. We'll have decarbonised transport ourselves for our patients and made sure that we're seeing the right patients in the right place, giving the right amount of time to those who need it the most. We'll have improved our waste management and supported optimisation of that for our patients. And net zero general practice has re-engaged patients and staff with nature, joining initiatives that optimise NHS green estates and engaging with blue and green prescribing, particularly in urban areas. Any action taken now as individuals, practices and more has an impact. But net zero general practice has collaborated and it has organised, because as an anchor institution, we can harness our influence so we can make sure that we expect those who work with us and supply to us also place people and planet at the heart of their decision making too. Net zero general practice is unique. It is key to whole system NHS net zero, and we provide a huge opportunity to improve the health of people and planet, and we can act now. Thank you.
Good, thank you very much, Georgie. Your presentation reminds me of something I learned on a management course once about, in order for change to happen, you need three things. You need a burning platform. We can't go on like this, which I think Terry presented. Then a vision, well, what would the future look like, which you just presented. And in a minute, we're going to hear from Aarti on what to do this afternoon to start making it happen. But before I introduce Aarti, can I just, somebody wanted me to repeat the hashtag, because all of this is being recorded so people can watch it at their leisure. So the hashtag is net0GP, net0GP. And can I remind you that to ask your questions in the Q&A. Right, let's now hear from Aarti Bansal, who's a GP and NIHR Research Fellow at Hull York Medical School and the founder of the Greener Practice Initiative. And she's going to talk about how will we get there.
Thank you for telling me I was on mute, and thank you, Georgie, for your fantastic presentation and helping us to connect this with our daily practice. So I've been asked to address the question, how can we get there? It's a challenging question. It's an interesting thing to think about. Yes, so I wanted to break this down into three main things. I think we need to build our motivation to work towards net zero. I think we need to enable action, and we need to embed implementation. So how do we build motivation? Well, I think we do it by creating a positive vision, the vision that Georgie has outlined, because working towards net zero is meeting the health needs of our people and our planet. It's about integrated healthcare. It's about creating health in our communities, and about making sure that the health determinants are working for health, not for disease. And it's about connecting this with our core values. So I'm really pleased that 76% of people thought this is part of our core clinical work. There were some people who aren't sure. So Terry has explained how actually working on the climate crisis is mitigating all the harms that will happen if we don't. And that fits with our core value of not doing any harm. But all those co-benefits are actually enabling us to work towards protecting and promoting health. It inevitably reduces health inequalities, and it helps us provide the sustainable healthcare that we need. But the other thing, as well as connecting with our values, as well as building a positive vision, is I think recognizing our power and influence. And as Georgie said, 90% of the population come to general practice in any one given year. And if you look at that graph, which you won't be able to read in the left top corner, that's from the Ipsos Mori poll about who do people trust. And people trust nurses and doctors to tell them the truth. We also know from research that framing the climate and ecological crisis as a health crisis and framing the opportunities as health opportunities is something that cuts across all political spectrums. It engages people across the world. And so we have a real opportunity to make that case. But also in our clinical practice, Georgie's given us an amazing example of the wider influence of just one clinical decision. Just going back to metered dose inhalers again, this one statistic really had an impact on me when I learned about it a little while ago. And that's, if you look at those, the highest carbon footprint metered dose inhalers, if we could safely and appropriately switch even 10 of our patients to dry powdered inhalers with a much lower carbon footprint, that's like the equivalent almost of an average UK person's entire carbon footprint. And in conversations that I've been having over the last 3 years, I noticed that health professionals, like most people in the UK, are doing quite a lot to try and address their own carbon footprint. So it's important to recognise how much influence we can have in our professional life as well. What about enabling action? Well, this slide mirrors very much what Georgie's already said. We need a baseline level of knowledge. We've assumed quite a lot of that knowledge in you today, and I think we've assumed that correctly, but there's a lot of variability, and everybody does need to know what the health impacts of the climate and ecological crisis are, what the health benefits are, what the hotspots are, and what we can do. And I think we need to be creative as well about how we communicate these things. It's just to mention again, in terms of knowledge, there's great work that's happening at the RCGP in making sure that GP trainees are going to be taught about planetary health in their curriculum. And in the undergraduate world, there's a lot of work going on as well. But I really like this infographic from the Irish College of GPs, where they've put on a page, you know, in just one instant image, all the different ways in which GPs working in clinical practice, whether you're a locum, whether you're a, you know, working at management level, everyone and their clinical practice can have an impact on net zero general practice. We can also have an impact in what happens in our practices as organisational institutions, and communicating this effectively and well, I think, is something we need to think about. Just talking about tools again, I'm going to mention the Green Impact for Health audit again. I think 40% of you were aware of this or using it. I might have got that statistic wrong, but hopefully by the end of this webinar, many more of you will be aware of this tool to help you take those actions. And also just to say that quality improvement is a key part of everything we do, and looking at this in a sustainable quality improvement way, so we're considering what our environmental and our social impacts are as well, is very important. And the Centre of Sustainable Healthcare have produced some really useful information about this. But where do you start? How do you get going? Greener Practice has tried to create a web resource. We're a group of voluntary people, so it's not the most corporate resource, but we hope that it is a one-stop resource hub for all of UK primary care to get information that is useful for professionals and patients, and we'll link you to other organisations and resources doing useful work, but also that it will link you to other people, it will link you to other local groups. This is a picture of our South Yorkshire Greener Practice group, and but this is a pre-pandemic thing. Now we meet virtually, but it's really important that we can connect with each other. We can support each other to develop in our ability to provide this kind of sustainable healthcare, but also that we can help support our wider community to do this. And we need to share best practice. And this is just an example of things that people have written about, what they've tried and what's worked. That's available in the blog section of the website. What about embedding implementation? So I'm just going to repeat something that Georgie has said, but I think this is really, really important. There are so many initiatives out there already working towards better healthcare, person-centered practice, social prescribing, working to eliminate health inequalities, making sure we have a resilient workforce, making sure we have integrated healthcare systems that are treating the right people in the right place, those who are most in need. And actually, it's really important that we recognise that our move towards net zero, that working towards planetary health actually strengthens, amplifies all of these movements. And we don't have decades to get these movements core and central to the way that we're working. We have a very limited amount of time to address the climate emergency. So this is a huge opportunity that whenever we're talking about personal and centred practice, or whenever we're talking about social prescribing, we link it in with net zero and recognise how they strengthen each other. We need to think about how we need to embed this thinking into all the ways in which we look at our systems. So in procurement, operations, IT systems, when we design our clinical pathways, when we look at medicines management, when we consider how we do our contracts, we need to have planetary health thinking at the heart of it all. And in order to have that kind of thinking, we need primary care leadership at all levels. We need clinical primary care leadership because there's an awful lot of clinical carbon, and we want this vision to be about the healthcare that everybody deserves. So we need that for developing green plans, we need it for implementation, we need really robust evaluation so that we can scale up all of these initiatives. And those four principles of prevention, patient empowerment, efficiently joined up systems and low carbon interventions need to be led by primary care. So I'm just going to end to say that I used to work at the academic unit of primary medical care in Sheffield, and I just want to make a shout out to Nigel Mathers, who was our professor, and someone who always said that the word crisis, or the character crisis in the Chinese language, has characters for danger and opportunity. And I think it's really important that whilst we recognise the danger of not addressing the climate crisis, we also recognise the huge opportunity towards an exciting and positive vision of net zero that we can really all join in. So I hope that you're feeling a little bit more motivated and a little bit more enabled to join this movement and to take action. But we're actually going to now ask for your thoughts in a poll, and really appreciate your honest answers to that.
Good, thank you very much, Aarti. Yes, I mean, I think this never waste a crisis is an important message. And I think one of the things I've observed is that during the pandemic, people's activity around this has arisen. So before we launch into the discussion, and people have kept marvelously to time, we're going to ask you 3 more poll questions. So the first one is, will you be taking action to achieve net zero carbon in your general practice? And I wonder if anybody will have the nerve to say no. I mean, you would expect in general practice there'd be somebody who'd say, no, I'm not going to do this. But so far we haven't got anybody. Marvelous. So everybody's going to take action. 99. Oh, well, no, wait a minute. We've got one. It might be interesting to hear from that person who's not going to take any action. Perhaps he or she will join us later. So there you can see almost everybody's going to take action. Now the next question, what may stop you taking action? Lack of tools that help, lack of resources or incentives, time, money, peer support, CQC requirement, or lack of personal motivation? Yes, well, that's kind of very clear that it's not lack of tools. Some people are saying that, but the vast majority are saying lack of resources or incentives. So that's something we'll pick up with Martin in a moment. How can people be supported to make the changes they need to happen? Because although we're emphasizing that you can change personally, you can change in your clinical practice, it absolutely depends on political action for us to solve this problem and to reach net zero. You can see the answer there. So mostly it's lack of resources or incentives. So we'll pick that up with Martin in a moment. And the last poll question, should the GMCs, get that up, should the GMCs good medical practice be updated to include, you must use the resources available to you judiciously, maximizing their effectiveness whilst minimizing waste and any harm to people and planet? Maybe not the finest collection of words, you could do with a bit of editing, but I think you see the message. And it seems that most people agree with this. It's sort of 85% that the GMC should take this on board. A few are saying no, and some are not sure. The GMC has a right. Okay, there you see the answer. So most people think the GMC should take action on this. Right, well, as you can, I hope you can see on the screen, we've been joined by Martin Marshall, who is the chair of the RCGP Council. So before we get to resources and incentives, Martin, can I ask you about that GMC thing? Because I think you're working on that, is that right?
Yes, hi Richard, and hi everybody. Thanks so much for inviting me to join you. Yeah, that's right. So we took a specific recommendation to the Academy of Medical Royal Colleges a few weeks ago, in which we shifted from what is a very light touch approach in good medical practice to planetary health, to a much more specific one that you can see on the screen in front of you. And that was unanimously supported by all of the colleges. So we've sent a letter to the GMC, and the initial response that we've got from them is a very positive, very receptive one. So I don't know how long this is going to take, but it seems to me that getting the kind of culture change is so important here. And getting that into our obligations as professionals, as doctors, is an important lever. So I'm really excited about what's happening there.
And then Martin, can I ask you as well, so you could see that when we ask people, why can't you do this? A lot of it is lack of resources, incentives. What is the college doing about that? And how can the college support people?
Yeah, that was very striking, that finding, wasn't it? And I'd be really grateful for other people's advice about this, because there's some principles here. I mean, first of all, the college has a really important role. So we're a well-respected institution, as medical royal colleges are. Most importantly, we have a responsibility to support GPs out there in the community who are really well-respected members of the community. So through the college, it feels to me like we've got a really important role to play, and we take that seriously. I think you've said yourself, Richard, that the RCGP is one of the leading medical royal colleges in this space. We're not doing enough. We could always do more, but we're doing a lot, which is great. I mean, for me, it's about what are the right levers for change, and I think most people prefer carrots to sticks. And some carrots are tastier than other carrots. So some of the recommendations, for example, that we've heard is, should we build it into CQC's regulatory regime, so that CQC goes into practices and assesses the extent to which practices are engaged in planetary health issues. Others have suggested we should build it into some kind of financial incentive scheme, building it into QOF. The problem with both of those things is the college has some concerns about both financial incentives driving professional behaviour and about regulation. So it would be slightly hypocritical of us to support both of those measures at a time that we're not quite sure that it's the right way forward. For me, it's about enabling people. It's about the culture change that I've described. It's about encouraging this to be a professional responsibility and then enabling it to happen. So I'm really struck by the importance of providing decent resources to practices, which is what the poll showed, decent resources to allow them to do things like engage with a greener practice scheme. Because I think when I haven't spoken to a GP that isn't absolutely committed to this agenda, some are more passionate than others. I haven't spoken to anyone that isn't committed to it. But helping them to find space at a time when normal life is so busy is the big challenge. And I think finding resources for that and delivering those tools on the back of the resources is really important.
Well, thank you, Marty. You asked for advice from the others on how practices could be supported. So I'm going to ask each of them. Let me start with you, Terry.
Thanks. Well, clearly there isn't enough support at the moment. GPs are very busy. You know, even before the pandemic, they were busy. Even before the vaccination process, they were busy. So it's very difficult to squeeze extra into what they're already doing. And, you know, GPs are basically in businesses as well. So there has to be a bottom line that they can afford to do things. I heard what Martin said, but, you know, clearly the NHS isn't really supporting GPs in getting to net zero. If you look at their report on NHS net zero, there's barely a mention of general practice in it at all. It just talks about estates management. There's really nothing else there at all. So, you know, unfortunately, the NHS relatively cheaply could be supporting GPs to do a bit on this. And once they get started, the whole point about sustainability is that you use less and you waste less and you save money. So it's good for everybody. But there has to be some initial starting point, some sort of incentive to get people going. People didn't donate PPE out of their best interest because it was a good thing to do. It never works like that. We have to have some incentive to get not just the early adopters, but the rest of the practices moving as well. So I hear what you say, but I think we need to do more.
Right. Okay, Georgie, how can we support people?
I completely agree, Terry, with what you've just said. And the vision that I gave was a net zero general practice was well supported. And it had the time. And I think that is absolutely key and crucial. And also taking up from what Aarti's been discussing, we do need to get leadership in this area so that these ideas can be driven forward. And I think particularly we talk about inequalities perhaps with patients, but we have to think about that in terms of practices as well. And we can't leave any practice behind with this. So that has to be the local, we have to have local action, but it has to be with a national push to try to get support into practice and leaders at every level to take this forward.
Thanks. And Aarti?
Yeah, so I agree with a lot of what's been said, and I actually share your concerns, Martin, about what incentives should we use to try and move this forward. I also agree with Terry that we do need incentives, but maybe what I think when I think incentive is that we need a bit of initial investment. So I think once the investment has been put in there, it becomes a sort of it's such a virtuous cycle to move in this space that it will be its own reward, you know, because work will become better, recruitment will become better, people's health will improve, you know, money will be saved, as Terry said. So once we can find the little bit of time and space and energy that is required to move in this area, then I think it will become its own reward and people will want to do it. I think probably what needs to happen is that we need to create and coordinate space for practices to do this. So I think they need to be given the tools and they need to be given free access to the tools, but that's not enough. They need to have the time initially created for them at sort of a slightly more senior level to engage with this in the maybe existing spaces that already exist, so like practice learning initiatives. And they need to have an opportunity to be mentored through quality improvement projects that they want to do. So things that people already want to do, but just a little bit of support to do them. And then we need evaluation of those things that are happening so that we can robustly and quickly scale them up. So I think there needs to be a little bit of sort of investment in time, and it actually isn't a lot of money. This is, this is small pots of money distributed widely. But I mean, the other thing I would say is, because I remember hearing you say, Martin, at the RCGP conference in February, the virtual conference that was held, that the countries that do best in terms of their healthcare are the ones that have a high investment in primary care. And I think the college can really use the net zero and the challenge around the climate crisis to sort of say, here, you need to invest in us so that the whole of the NHS can meet primary care. Because part of the reason that primary care will struggle to meet this agenda is because we've been underinvested in. So bringing those two things together and saying, this is, we need a strong primary care system for our patients. The evidence is there. We need a strong primary care system for net zero, net zero NHS. So I think, it's also about linking those together.
So Martin, can I get you to respond to that? But before I do so, can I just say, I mean, Simon Stevens, who's the Chief Executive of NHS England, I think is very, very serious about this getting to net zero. And it clearly can't be done without resources and some investment. So I wonder how much you're speaking to him and to Nick Watts, who's the NHS Chief Sustainability Officer, and how you respond to the advice you asked for and have been given.
Yeah, it's interesting. We're probably not having enough conversations yet with Simon, and you're right that given his personal commitment to this area, I think we need to do so. So that's something that we can take forward. I agree entirely with I agree entirely with Aarti that this, in many ways, it's about integrating planetary health agenda into our broader agenda. So I think as a college, we're on a journey like all organisations are. I think it's probably fair to say that we spent too long thinking, how do we do planetary health on top of everything else that we've got to do, rather than saying, how do we integrate planetary health into our other, into our broader mission and our broader priorities. So we've got priorities around reducing workload. We've got priorities around helping people to change the way they work, particularly the use of technology. We've got priorities around personalised care and relationship-based care. All of those can very easily be adapted into a planetary health environment. And that's absolutely what we need to do. Final point, Richard, just very quickly. Whilst I am a bit suspicious about incorporating incentives into the QOF indicator framework, I think it's important to remember that as a product of college lobbying over several years, 20% of QOF is now related to quality improvement programs. And it'd be much better to build a commitment to planetary health and the kind of practical activities that Georgie and Aarti have been discussing into that element of QOF, it seems to me, because this is very much about a quality improvement ethos.
Good, thank you very much, Martin. So we've got a lot of questions here, and I hope it might be possible to pick these up afterwards. It isn't going to be possible to answer them all in the time we've got available. But a question that's come through from quite a few people is, where, if you've come to this webinar, you've been inspired, you think, I want to do something, where should you start? I think it was quite a lot of people have asked that, a slightly sort of overwhelming series of presentations. What's the one thing each of you, I'm not going to ask you, Martin, although you could weigh in at the end if you want, what would you do this afternoon to start making this happen? Terry?
Well, it's got to be metered dose inhalers, really. There's a really great information sheet on the Greener Practice website, which explains exactly which inhalers you should be using and how you should be using them. And it's a great summary on about, I think, 3 pages. So I would go there and I would follow the instructions on that. And that's going to have the biggest effect on your carbon footprint in the fastest possible time. Good,
thank you. Georgie?
Well, I agree with Terry. That is the hotspot, and we can take practical action now. I think, though, as well as a few questions I've noticed about what can I do if the rest of my practice aren't keen, what can I do if I'm a locum or a salary doctor? So I think it's about looking broadly through the Green Impact for Health scheme at where the hotspots are, but also finding your own strengths, as Terry's pointed out. We need lots of people doing things to the best that they can, rather than just a few people doing things brilliantly. So if you're someone who's passionate about physical activity, or you're able to set up systems within the practice to make sure that they're as accessible as possible, and you can share that knowledge, then focus on what you can do best while you wait for everyone to join in as well.
Thanks. Aarti?
Yeah, so I've just seen that somebody's put in the chat, go to a 100% green energy provider, which is a really fantastic quick win that you can do. I would say try and find a time to talk to your team. Do something like maybe watch this webinar or just do a 10-minute presentation about what do we want to do, look at the green impact for health, and then work out what you're going to do, what you want to do as a practice to move this forward. And as Georgie says, everyone's got their own passions. So you might be somebody who's really excited about nature-based interventions and you want to do something to create a green directory so that the next time your patient is faced with a choice, you can offer them a really useful choice, maybe via AccuRx, you know, giving them all the local places that they can go for a walk, or maybe all the different activities. You know, you might want to do that. Somebody else might want to work on doing a quality improvement project around inhalers. I think about making a start on something that you care about. I'm just gonna, it sounds like a plug, but I did write a blog on 6 steps to sustainable primary care, which sort of looks at 6 key areas that people can look at. But yeah, I think it's about finding one thing that you want to do and going there and use the tool, use the Green Impact for Health tool.
So where is your blog, Aarti? If they search by your name and 6 steps, presumably it'll pop up.
Yeah, 6 steps, BMJ blog. I shall try and put it in the chat.
Right, okay. Do you want to say something, Martin? I'll give you an opportunity.
Yeah, just that I agree entirely with Georgie and Aarti that one intervention isn't going to engage everybody, and so we need to have a range of interventions. So going for the Greener Practice Award, encouraging practice to work as teams, and I guess most importantly, actually find a network of people who are like-minded, who will encourage you. So, you know, Aarti and Terry's leadership of the college's work has just been phenomenal. There's a great group of people there that you can engage with. If you're interested in kind of, you know, higher level things, the UK Health Alliance has got a great website and some great resources. Find some like-minded people and their enthusiasm will drag you on.
So a cheeky question, Martin, has your practice done anything and what has it done?
Well, actually, yes. And it's not that cheeky question. It's an easy one for me because I happen to work in an amazing purpose-built health centre in East London, which was designed as the medical centre for the Olympics. It's the greenest building you have ever seen in your life in every way. Admittedly, not everybody can have an Olympic facility to work from, but it's an amazing building, and that impacts on the way that we think and the way that we work within our practice. We think about green issues in a way that I never did when I worked in a less good facility. Environment's really important.
Good. There are other questions about prescribing, and you know, drugs are something like 20% of the whole of the NHS footprint. And I always, when I look at prescriptions for antidepressants, which are sort of going through the roof, I think there were 70 million prescriptions last year. What can people do around prescribing? Terry?
So individually, you know, there are lots of movements, the overdiagnosis, overtreatment, choosing wisely movements, which suggest that a lot of these things are started maybe too soon and kept going too long, and alternatives aren't being used. Actually, our RCGP group is set up with the RC Psych to look at this very problem. And one of the things we're going to be looking at is trying to improve the supply chain so that the pharmaceutical manufacturers have got to get down to net zero themselves by 2045 if they want to be bought by the NHS. So we're suggesting that there should be some sort of scheme so that we know whether they are on the journey to compliance with that, and so that the pharmaceutical suppliers, manufacturers who are more advanced on the journey are treated more favorably than those who appear to be ignoring carbon net zero requirements. So there's lots of different levels, but as an individual, there's no doubt that these medications are overprescribed and the treatment is not optimized, and alternatives aren't used, social prescribing, counselling, all the rest of it aren't used enough.
Yeah, I mean, we know as well that about half of drugs are never taken. So Georgie, do you want to say something?
Yeah, I mean, this is a huge issue, multi-dimensional. I think I'd look at it perhaps through the pillars of sustainable, the Centre for Sustainable Healthcare, and look at look at the 4 pillars of clinical care through that side of things, because actually if we treat our patients with high quality pharmaceutical care in their communities, then we can reduce admissions and we can make sure that we optimize our patients' health and are delivering a person-centered care. So it's not all bad, you know, prevention's really important and not everybody has choices. But of course, as well, we have to think about medicines waste and we have to think about medicine optimization, and we have to really be linking up with our prescribing optimization teams, and we have to be working really hard to all have a shared voice. And that's part of just looking through planetary health at that 1 point patient intervention, but then expanding that right out to every single member of a team, from secondary care onwards to our medicine optimizations team, who would be involved in that whole clinical care model. So it's a really, really complicated question that I think probably deserves a webinar on its own.
Aarti, a really complicated question.
Yeah, it is a complicated question, and I want to just agree with everything that Georgie has said. There's a few things, as well as looking at what is the evidence base for the medications that we're doing. I think IT's got a role to play here. So I feel like it's quite difficult as a clinician when my patient's on 10 plus medications to work out when to stop it. It's quite difficult to have those conversations. And I think there are lots of really amazing tools out there, but they're not very well integrated. That's a piece of work maybe that is harder to do at individual clinical level, but needs to be done at certain levels to really help support us as individual clinicians to do it. I came across an amazing colleague in Sheffield who's done he's an IT bod and he's done some brilliant work on looking at tools to help reduce the anticholinergic burden in our patients. And I think, you know, we need to look at some of those kind of things. We also need to look at the huge amount of waste that happens when patients receive PRN medications every month that they don't need. And there needs to be some work at looking at how do we make sure that we can stop that safely. I think the CCG in York has done some great work there, so we need to share some best practice there. But all the other things that, you know, have been mentioned that we can do clinically, I think to some extent it's about giving ourselves permission. It's just, you know, we maybe feel it's very hard when, as doctors, when patients come to us and they've got problems, you know, it's easy to reach for the prescription pad, but actually reminding ourselves of the evidence around these prescriptions. Like Georgie said, often there's really good evidence and we should be prescribing, but sometimes there's really good alternatives and we really should be considering those alternatives for people, or potentially giving them those alternatives as well as prescriptions. And it's giving ourselves the permission to do that actually we are enabling health when we do that and working towards planetary health too.
Good. Martin, would you like to add something? And then I come to Terry.
Yeah, it's one of the areas that we're working on hard as a college at the moment is around, I guess describe it as the judicious use of the medical model, using the medical model where it adds value, but recognizing that so much of what we do has social origins and therefore social interventions are more likely to be useful. And in answer to your previous question, Richard, alongside having a very swanky, environmentally sensitive building, we also have a lot of social prescribing schemes in East London, which we utilise a lot as a college. And I think that's, you know, it's partly a kind of technical thing about remembering to use social interventions when you can, but a lot of it is a mindset thing as well about using the medical model where it adds value, but using social models where you don't. And that's something that we're really promoting and pushing hard as a college. I guess, you know, almost by definition, we're one of the few medical Royal Colleges to do that. You know, we're interested in non-medical causes and interventions.
So you should be.
Yeah.
So yeah, I just want to say, because we're just getting up to the 2 o'clock thing, and we said we finished promptly. There's been loads and loads and loads of questions here, which you just can't answer at the moment, but I will take those questions away and I'll formulate the answers as best I can. And I'll put them on our Green Impact for Health newsletter. The next edition is on the 29th of March. So if you haven't already registered for Green Impact, if you register for it, then you'll get a copy of the newsletter. And I'll also look at the chats and do the same. So there'll be a sort of bumper edition with answers to those questions, because they're some great questions, but you know, it's just impossible to read them, think and answer at the same time. And if you don't know how to get onto the Green Impact for Health Toolkit, just Google or Ecosia. Actually, don't do Google anymore, do Ecosia. Ecosia RCGP sustainability, you'll go onto the RCGP sustainability webpage and there'll be a link there to the Green Impact for Health Toolkit.
Good. Well, you saw there were loads of ideas there.
Yeah.
Has been recorded. Urge your friends, your other people in your practice to watch it and think about how you can get started, because everybody said they wanted to do something. So thank you very much to all of our speakers, and they've stuck to time. We had lots of time for the discussion, which is great. Thank you very much. Bye-bye.